Okay. Now, Professor Schwartzstein, with this, interaction between patient and physician, here in Kuwait, most of the job is done by the physician. And we still are struggling to have what we call the paramedical staff. Now, I know you have in your institute these kind of people, but do you actually graduate or train people to get into this business?
Well, we train the doctors about working with teams, whether it's in the hospitals or in the outpatient or ambulatory setting. And I think that's the key part. We're not training nurses so much in our institute, but the focus is on medical students as well as doctors who are continuing their training after graduation from medical school to not view themselves as loners. That's been historically, doctors sort of view themselves as the loner who can take care of everything himself or herself. And now the notion is that the best medical care isn't provided that way. The doctor certainly has an important role in orchestrating the overall goals and plans of care, anticipating problems like an infection happens and the diabetes will be under poor control, and again, how to train the patient, how to deal with that and anticipate that. But in terms of follow-up in between visits to the doctor, questions that may arise where the doctor doesn't always have time to give the attention that they might need to the patient, this is where these additional personnel really make a big difference, I think, with the team concept.
Now, do you really get involved earlier with the students too?
Yes, we are working with the students typically when they begin their clinical experiences, and we're now trying to bring some of this even into the early parts of training where they're focused mainly on the science through case studies. So we have cases that the students study on paper, but in the discussions of those cases we pay attention not only to the science part but to the communication elements as well.
Yeah. And do you focus on like certain diseases, or is it just a general idea of education? Do you have any, programs for certain chronic diseases? Because there are some chronic diseases who are actually demanding, like diabetes, ischemic heart disease, chronic renal failure. It's more demanding than, other diseases.
Our approach has been that there are certain principles that are common for the management of chronic diseases in general, and so we focus our efforts there. I mean, again, earlier in the show you were talking about asthma, which is another great example. These people have to live with this disease. They have to anticipate seasonal changes. Food intake sometimes will trigger an asthma episode. And to help the patient understand that, to use the rescue inhaler at the appropriate time, to increase the controller medication, all of these nuances which seem simple sometimes to the doctor are very complicated for the patient. And so the same principles of explaining what to look out for, how to manage your medications, how to manage the environmental factors at the same time really are quite common across many of these chronic illnesses.
And do you have regular programs for patients to get in and learn, or it's just only for physicians?
At our hospital we actually do have a center that focuses on patient education as well. And we are beginning to do more work with the doctors about this notion of patient education, as well as developing materials, which is an important thing, things that we can hand to the patient, drawings of parts of the body, things like that, anything to help them really understand the biology of their disease so that they can manage it better with the team.
Now, with the era of the internet, and do you think that the internet is actually helping, or is it something that it's actually getting people wrong messages?
Yeah, I think if you ask a lot of doctors, they'll say it hurts because there are more questions and they spend more time answering the questions. But I actually think that's a good thing. I mean, to the extent that it is empowering the patient to understand more about their disease, even though some of the information they get from the internet may not be totally correct, it begins that conversation. And I think beginning the conversation and having patients really feel like they're taking some ownership of their problem in the end is going to be a good thing.
Because, in the next generation coming, they're going to live in the cyberspace. So, handing papers may not be enough. And we still see that in our patients. And most of our patients, for example, they like to get hooked with us on emails, for example.
That's right, and that's become something our hospital has been spearheading to make sure that the email is a secure and confidential communication. But if you have a system that can do that, the patient can get their questions answered in a more rapid way, and more convenient for everybody. And again, anything we can do to improve the communication between the team and the patient and family, I think is a benefit.
Yeah. Professor Kaldany, now we'll go back to Joslin. Joslin is also known as one of the supreme places for research in diabetes.
Correct.
So, I always, when I was there, I always say Joslin is where bed meet the bench.
Absolutely.
So tell us about that.
Well, you are familiar with much of the research going on. Let me start from the top, working my way. About the eye unit, as you know.
Do you mind if we take this call from
No,
Saudi
please
Arabia?
do. Sure.
Before you continue. Muhammad?
Assalamu alaikum.
Wa alaikum salam.
I have a question, doctor.
Yes, go ahead, Muhammad. You're on the live.
What are the functions of pancreas apart from producing insulin?
Okay, we will get into that. Thank you for calling.
If there is a failure of pancreas,
Mm-hmm.
what will be the effect on the body?
Okay, thank you. Thank you.
I didn't get all the questions.
I'll get
Okay.
to a couple of questions. So
All
let's start, and
Let's
then
start from
if
the
you
top.
just continue with us, Muhammad,
Yeah.
you will get your answer. Yeah.
Okay, from the top about the eyes, as you know, the eye unit, Dr. Ayalo is the one who pioneered
Yeah.
laser in the eye. And right now, instead of having blindness in over 25% of type 1 diabetics, it's less than 2% now. So this is one of the effects of, and now they are pioneering some new medications like a tablet that will hopefully be approved by the FDA soon to prevent progression of the eye disease. Moving down, there are about the pancreas now. One of the pioneers in the islet cell transplantation will be here joining us
Yes.
at
Yeah.
Dr. Gordon Weir
Yes.
in 2 days. And he has done a lot of novel work about this. And he and Dr. Susan Weir have found
His
a way
wife,
to
yeah.
take his wife, the acinar cells, to re-educate them to work as beta cells, and hopefully that will help a great deal down the road. We have a lot of people working on stem cells to replace the pancreas as well. Talking of the blood vessel, George King and his group are working on endothelial cell as being the impact point between the circulation and inflammation changes of disease. And so the research is very active. Each facet of it is applicable to the patient, and that's where we talk about translational research, where you translate basic science into effective treatment. Now, the question of the that just came about pancreas, he was asking.
About the functions of pancreas.
Oh, the
Yeah.
pancreas has actually two functions. One of them, it's a digestive gland. So when you eat protein or fat or glucose, after it goes through the stomach, the enzymes in the pancreas help you digest, break them down in molecules so that your bowels, your intestine can absorb them. But also there is another function to the pancreas, which is endocrine. It secretes many hormones, two of which are important for patients with diabetes. One of them is insulin from the islet, from the beta cells in the islet. And that insulin is what maintains the blood sugar normal. The other hormone is glucagon, which jacks up the blood sugar. And in a healthy person, it's that balance among other hormones and these two that keeps the blood sugar normal.
Yeah. So it have more than just simple function
It has
related to diabetes.
more than that. And
What happens if the pancreas fails? Or
if the pancreas fails, which
that's
side
another
of it?
question. Yeah.
The exocrine pancreas, which secretes the digestive enzymes, if it fails, patients cannot digest. They get indigestion, they get diarrhea, they cannot absorb food. The other pancreas, the endocrine, if the islet cells fail, patients become diabetic, whether they fail because acutely or because of autoimmune event, as it happens in what we call type 1 diabetes. This is the diabetes where patients are thin and they require insulin. It's observed mostly in youngsters. Or the diabetes from gradual failure because of fat infiltration, scarring of the tissue, which you find in type 2.
Yeah. Now, Professor Schwartzstein, I want you to talk to us specifically about diabetes and the role of the patient himself. And you said that the theory now is changing, that the patient should take over some of his management. So tell us in specific about diabetes, because that's the theme of the next coming conference.
Well, so, for example, many diabetics must check their blood sugar frequently during the day, make adjustments in their insulin dosing if they're taking insulin. They need to consider when they're going to eat. If they do take insulin and it's a long-acting preparation, they need to understand they may need some snacks at various times. If you exercise, that enhances the action of insulin. So if you have a youngster who's diabetic and is an athlete, they have to be able to gauge, again, how they're going to eat, how they're going to use their insulin in the context of that. If they get an infection, sometimes something as simple as a bronchitis, that can again throw off how much insulin they need because the body becomes more resistant to the effects of insulin. So these are things that happen literally on a day-by-day basis. And the patient can't be calling the doctor 2 or 3 times every day, what should I do now? So educating the patient so they can make these changes and modifications keeps them out of trouble, keeps them from having to be admitted perhaps to the hospital with a serious diabetic complication. And it's that type of understanding of the biology of the disease and again how all of these factors influence the way insulin and glucose metabolism works in the body that will keep them out of trouble.
Now, we have this very frequent question in my clinic and in many clinics that they say, doctor, why should I test? I mean, and hurt my fingers and, you know, you do this HbA1c 3-month stuff every 3 months. So why should I, you know, test every day and get the pain?